Okay, so as we start exploring the emotional impact of chronic pain, chronic illness, chronic symptoms, really, let's grab a notebook and maybe a pen and paper. Look at how this has impacted you personally. So I know how it's impacted me, but we want to start reflecting on your experience. Often we call that your lived experience, how you've lived with this so far, and how it's affected your emotions as they come up daily, but also long term, like the grief process. You've probably had things that you've lost in the way. When we think of grief, normally we think of people we've lost when they've died, but there's a lot of grief that comes up with a chronic illness. I got my diagnosis, well, not even diagnosis, I got my symptoms when I was 18. It took years to get diagnosed. But what I found was I lost friend groups. I lost normal activities some of my age should attend. What kind of things have you attended or lost attendance? Were you working at the time and then couldn't go to the setting that you're used to or see those coworkers that you enjoyed seeing? Did you lose activities you enjoyed? Sometimes a big piece of our self-care is going and exercising, relieving the stress. But when we get chronic illness, we can't go out and exercise the same way we used to. Even something like surgery changes the way that we can do things we enjoy. And so sometimes depression comes up. I think a lot of times, though, doctors say that you're depressed or you're anxious. It's not a diagnosis. But what there isn't a recognition of is that, of course, there's depression and anxiety. Everything in my life changed. That's a big dramatic adjustment. There's going to be a grief process to that. There's going to be a loss of enjoyment in life because I can't do the things that I'm used to doing. My self care tools aren't working anymore because I can't do them. So, looking at how it affects you, pause right now, look at that. Did anything I say trigger anything in you? What kind of feelings came up for you in that moment? What is your body feeling like right now? And as you look at that, observe what's the emotion that comes up. Is it sadness? Is it grief? Is it loss? Sometimes it's anger. Because along the way, there's also those senses of being treated like a human. If you go into the doctor's office and then they treat you like you're anxious about a symptom, and it's just anxiety when you're feeling palpitations, it feels like a real heart issue, but they're not taking you seriously. There's that human need of not being heard that's going unnoticed. There's a lot of that along the way in the healthcare system that can impact how we handle our chronic illnesses. Often it impacts how we feel about ourselves, how we feel about our doctors, how we feel about family that doesn't get it. Because along the way of chronic illness, there's a lot that don't get it. So, what kind of feelings are arising when you're in those symptoms? What feelings arise as you go through this journey? Let's look at